Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Hey guys, welcome back to our podcast, A View from the Bed. We are very excited to talk to Rick today because it's a surgery that we haven't talked about before with one of our surgeons, Dr. Attili. So Rick, thank you for joining us today.
You're welcome. Thank you for having me.
Yes.
Yeah.
So we were talking right before the camera rolled that a little birdie found you for us while you were actually still in the hospital.
She showed up,
Yeah.
not at my window, but at my door.
Well, and you had such amazing things to say about your journey and Dr. Attili that we were like, oh, let's see if we can get him on the podcast.
Well, thank you. You can call me Rickey, by the way. I haven't been called Rick since the third grade.
Then we'll call him Rickey. We definitely don't want to throw you off.
It might.
Good. So, okay, tell us a little bit, where did your journey begin?
Okay, so the night before my surgery at 2 a.m., I woke up with a terrible pain. And it started in my shoulders.
Okay.
And I have had heart surgery here back in, I believe it was 2006,
Okay.
open heart surgery, and it was good too.
Yeah.
Had a wonderful doctor who was here a long, long time. Dr. Metters did my surgery. Fred Metters. Anyway, he's great. And anyway, I thought Dr. Fletcher is my doctor that works out of here too, Anthony Fletcher. And so I thought, it's my heart. So I came over, I toughed it out for about an hour and a half. Got my daughter up. Thankfully, I was here in Little Rock. My daughter lives here in Little Rock. And so we came over to St. Vincent since I thought it was my heart. And immediately they got me in the ER. I mean, once I said the word heart, it was like, there you go.
Like a quick access pass.
Quick access pass, yes. And so it took them about just a very short period of time to realize it wasn't my heart. I'd never had a pain like that. It started here, went down, but then it came down lower, which I've never had. And so they started checking me out. Dr. Lewis was the ER doctor. He was great. And it didn't take them very long after that they said, it's your gallbladder. And they said, you have a stone that's worked its way down into the neck of your gallbladder.
Oh, no.
Yeah. And so he said, I'm going to get you a really good doctor. And I had no idea he'd get me a really good doctor. I mean, he got me a really good doctor. God had to be overseeing this.
Yeah.
I'm a pastor, so I'll talk about him a little bit.
Well, yeah,
He's been very good to me.
Yes.
Well, anyway, Dr. Attili came by, and from the first minute I met him, he made me feel comfortable. He was just so nice. He made me, it's like talking to someone that's been your friend for a long time.
Yeah.
And so he told me the urgency with that gallstone working its way down the neck, that if it gets in the bile duct, it would be worse. And so he said, we're going to have to operate on you. And they moved me from ER to a bed. And I was operated on the very next day.
Oh, wow.
And you believe that was just how everything fell together.
That's phenomenal.
And so once I got up to the floor pre-op, well, I have never seen such nice people taking care of me. It was just like, and my two daughters, I have to mention them. I have two daughters.
Yeah.
And they stayed with Daddy.
Yeah.
And one had to work a little, but she came immediately. And the other one stayed with me the whole time.
Oh, wow.
And no one ever said anything. They were welcoming to the girls. And they stayed there. And from the first minute I got up there, they were taking really good care of me.
Well, wonderful. Well, before you had that initial onset pain, had you been having any stomach problems? Or, you hear some people say with gallbladder, they'll get like acid reflux or anything like that. Is there anything looking back.
A little bit of acid reflux, just a little bit, but nothing hardly. I mean, it was just like one attack and that was it.
Yeah.
I mean, one big, big attack and that was it.
Yeah.
And so I was like, what in the world's going on with me?
Yeah. Because, we talk a lot on the program and encourage people that if you think it's any kind of chest pain, even if it might just be like an indigestion pain or things of that, always go to the ER because you just never know. Because like in your case, since you had had heart surgery previously, it felt
I thought it was
like a heart incident.
It really did.
Yeah. So it's really important that it doesn't matter, even if it's just gas, go to that ER, because even if it's not your heart, in your case, it's something just as serious that you could be having.
I took a little something for indigestion, acid indigestion. It didn't touch it. So I thought, but you're correct. Get in here. Get into a good place like this where they'll get you right in.
Did your daughter scold you though for waiting so long to do anything about your pain?
Well, actually, I woke her up at 3:30 in the morning, so she wasn't too awake to scold her dad. So I probably would have if she'd have been more at herself. But anyway, she jumped in and we came right over. And thankfully, she only lives about 15 minutes from the hospital.
Great. Yeah.
So we got over here really quick.
So when you woke up from surgery, let's talk a little bit about the recovery process. So how long did you have to stay in the hospital after your surgery, and what did that feel like? Was there a lot of pain associated, or did you feel pretty good?
So when I came out of and by the way, they were really nice to me when they rolled me back there. That I want to mention the people that got me ready that were in the operating room.
Oh, yeah.
They were really nice. They told me exactly what to do. They tried to make me feel comfortable. Okay. They told me, first of all, they were just going to have me breathe normal and it wasn't going to put me to sleep yet. Mm-hmm. And then they said, you're going to have, now it's time for you to go to sleep. Okay. So anyway, they walked me through the whole thing. So I wasn't scared. I had a good feeling about it.
That's good.
And I don't think the surgery took very long at all. Dr. Tilley had told me it'd probably take somewhere between 30 minutes and an hour and a half. I think it took closer to 30 minutes.
Okay.
And it was robotic. So, wow, that was amazing.
Yeah.
So I just have some little places here. Okay. And they're going away, really.
Yeah, so, like little pinpricks.
Just here, and like right there.
Okay.
And so they're healing up nicely, looking good. So I was in recovery for a little bit, and I was like waking up and like, I thought I was in pain, but I don't think I really was in much pain. Very little, if any, very little, just uncomfortable, sure, with what had gone on. And then I ended up staying in the hospital 3 days because, and you don't normally do that, but I have a habit of having low potassium. Okay. And they caught that immediately. Low magnesium. They caught that. Yeah. So they have to give potassium slow. And I think Dr. Tilley was just absolutely making sure that I was okay, and I'd had a little bit of hemorrhaging, which I didn't know, but I wasn't feeling well, for the last few days prior to that attack. Yeah. I didn't know what it was. I just didn't feel well. Okay. And he told me, he said, you actually had a little bit of hemorrhage in that gallbladder. Yeah. So, boy, I'm glad.
Even more important that you got it taken care of. Mm-hmm. Because, you just never know, especially with the time of year it is, you never know, is it a tummy bug? Is it just something I picked up? When you start feeling not well until you have something more severe like you experience. Mm-hmm. I will tell you, though, that robotic surgery is amazing. Just the recovery time that it takes off your body.
Incredible.
It is. And then if you ever see them work with the robot, it's almost like you're playing a video game where they like operate it and just move the little fingers of the robot to do what they need to do.
My little grandsons would enjoy something like that.
Oh, yeah.
A little 4 and 10-year-old grandsons. That's pretty cool. That it's like
very
that.
Very cool.
Mhm.
And I mean, like you said, it's some discomfort, but
It's not much.
Not much.
Not like what the radical, like some of my older relatives told me about
like long and
long and and it's like, oh, thankfully I didn't have to have that.
Yeah, no, that's phenomenal. And then I'm glad you brought up too the importance of the care team, because sometimes when you're in the hospital, you're like, why are they always taking blood and checking your blood pressure? All the things, right? You get woken up. But when you have something like you did after surgery where your potassium and magnesium aren't where they need to be, that can really hinder how quickly you can recover after a surgery.
Yes.
So them waking you up to, do the blood work and things is so very important to just them keeping a check on all of your levels while you're with us.
And I tell you, I'm a hard stick.
Uh-huh.
My veins are deep, but some of those young ladies from hematology, one in particular, she said she's just talking with a soft voice, and she's talking to me. And the next thing I knew, she'd gotten the blood and I didn't even know she stuck me. It's that easy. Yeah. I've never been stuck like that.
Uh-huh.
Just easy.
Just super easy.
And not made a pincushion out of.
Yeah.
It was nice that they knew what they were doing.
Yeah. Get it on that first try. That makes a big difference.
It does.
You have someone, if you've been told, your veins are deep or they roll or jump, sometimes you'll hear
all the above
say that. But you just got dancing veins.
They're everywhere.
Got catches.
Yes, that's right. Uh-huh.
That it does make a big difference.
It does.
In your care. And not dreading your next blood draw to check.
Yeah, I've had that happen before.
Yeah. So how has life been? Have you just kind of bounced right back and
well, sure. People keep after my surgery, when they'd see me, they'd say, well, you look a whole lot better. You look like you feel a whole lot better. And he also went in and he said there was sludge in my bile duct, but he's so qualified. He said, I took care of that. I took all that out.
Oh, wonderful.
So he cleaned the bile duct while he was in there. And I think all that was dragging me down.
Well, when you hear something called sludge.
Yeah, he called it sludge.
You don't think that needs to be in the body.
I don't believe that should. No. Doesn't sound good.
Doesn't sound good. It sounds like something you get underneath your tire after a snowstorm.
I believe you're right.
It's like that sludge. You got my tire stuck.
Mm-hmm.
It just had your body stuck.
I was just, pastor. Yeah. And, I see a lot of people. Preach in Spanish and English.
Oh,
both.
Wow.
Spanish in the morning, English in the evening.
Oh, my goodness.
And so I see a lot of wonderful people.
Yeah.
And some of them were actually noticing that I was overly tired, didn't look like I felt well. And now they tell me, wow, you look a lot better.
Yeah. Sometimes you hear too, like after a gallbladder surgery, sometimes your eating habits can change a little bit, or tolerance to things like lettuce. Have you noticed any of those kinds of changes to your eating habits?
At the first, I did.
Did you?
I had to be careful a little bit at the first, but I'm on a weight loss journey right now. I'm halfway.
Oh, wonderful! Congratulations.
So I was being careful to begin with, but some of that is on my diet. I had to be really careful with it the first, but it's not affecting me now like it was.
Good.
I'm pretty well eating back where
you were.
But
that initial,
I want to go on down on my weight journey here.
Hey, well, it sounds like, you got the sludge going. You've got a little more energy again. Mm-hmm. So it sounds like you're right in line to be back to where you want to be on your weight loss journey, which is phenomenal. Yeah.
I've got my class reunion coming up. I want to surprise them and tell them that, it's my 50-year class reunion.
Oh, wow.
And so I want to surprise them. I don't want to look as old as they do.
Hey, that's a good
I'm kidding. They're wonderful people. But anyway, I want to look as well as what I possibly can when I go.
Oh, that's phenomenal. And it's so amazing that you brought up weight loss, because we're actually next month talking to one of our weight loss surgery patients and their journey on how they've lost about 100 pounds.
That's wonderful.
And so, well, you don't look like you need weight loss surgery. You've had enough surgery.
I don't want weight loss surgery right now, but I am doing weight loss diet and things like that, exercise.
Yeah. So, and I'm sure that just having that sludge and that gallstone, taken out has just made you feel so much better.
It made a difference. It really has.
That's wonderful.
And Dr. Tilley, I told him when he did my follow-up checkup, I said, can I give you a hug?
Oh.
Because, I was elementary principal for a long, long time. 46-year Arkansas public school administrator and teacher, all in one district.
Well, bless you.
And so I got a lot of hugs, and I gave a lot of hugs. And as pastor, I get a lot of hugs. He said, may I give you a hug? And he said, of course. Yeah. And he said, you're so kind, and he called me his friend.
Yeah.
How many doctors do that? I mean, seriously.
He is a rare one, for sure.
He's great.
He is. and talk about just...
And this is a rare hospital, too. They take wonderful care of you.
Well, we're pretty partial. I'm pretty partial. We've got great people, but, like you brought up earlier, you being a man of faith, as a faith-based facility, it's just wonderful when you can have nurses and doctors that'll pray with you and hug you and really, like you said, treat you like a dear friend or a family. That makes all the difference.
I love it.
Even if you're having a little bit of a rough time, recovering or a rough diagnosis, that makes all the difference.
Pastors need hugs too. And patients need hugs. And
yes.
Some of the nurses, I believe one of them's name was Michael, he would make me feel comfortable and talk to me. Well, all of them would make me feel comfortable, but, we even, for the short time that I know he was very busy, but we just share some things about our lives, and it just made me feel comfortable talking.
And, I know a lot of times we say that our caregivers, our nurses, and our patient care techs, and they're here for our patients, but our patients are here for them because, to your point, sometimes our nurses need an encouraging word or just a thank you or a hug, and that makes their day.
I try to be a very positive person, and if I can't say something nice about someone, I don't want to say it. And so I don't want to leave out the nurses' aides either. Oh. And even the ladies that clean the room, because when I was principal, your staff is so important to the running of a school, all the way to the custodial staff. I tried to make them all feel welcome and do nice things for them.
Yeah.
And the nurses' aides were good. They were very nice to me. The cleaning ladies would visit with me.
Yeah.
It was just like everyone was trying to make me feel comfortable here at St. Vincent's.
Well, we love to hear that because that is our job, is to not just get you well, but send you some positive human kindness on the way and to be there for you when you need something.
I got it.
Well, we appreciate you joining us on the podcast today. And it's just, like I said earlier, just such a reminder that if you have any symptoms that seem out of the norm, even if you're just experiencing extreme fatigue, pay attention. Talk to your primary care provider. If you have bigger symptoms like Rickey had, please go to the emergency room. Go to the nearest emergency room. If you can't drive, don't drive. Call 911. That's very important, is dialing 911. That can save your life. So, and we always say, if it doesn't feel right, it's probably not right. So I mentioned earlier, next month, we're talking to a weight loss surgery patient who lost close to and over 100 pounds. By the time we talked to him, it's probably over 100 pounds. And just to help you understand what that journey looks like and if weight loss surgery is right for you. So until next time. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.